let's head over there where we have Hospital Administrator Lillian Posadas standing by. Good morning, Lillian.
Hi, good morning.
Good morning.
Good
Nice
morning,
color.
Mom. Good morning, everybody.
Yeah, digging
Oh,
that.
thank you.
A little bit of a
Yeah.
bittersweet weekend, Lillian, as we saw the further easing of restrictions, but it was coupled with
Right.
high numbers of positives and 3 COVID-related fatalities. So I guess if we
Right.
could just start there, Lillian. I mean, I hate to start that way, but what else can you tell us about these
Okay.
COVID-related fatalities?
Well, basically, there's no other. Okay, if the two, as it was already, put out in the JIC, the first one on Saturday, a 90-year-old individual, and then on Sunday, a 66-year-old individual. Both of them came in pretty much already as dead on arrival. They were pulseless, breathless, and so, those were the conditions. One of them was a known COVID positive from being tested with public health. The second one on Sunday was not known, but was swabbed in the emergency room, and the test result came back positive. So both are COVID related, and so our condolences and our prayers to the family.
And we'll just move right into the COVID census at the Guam
And
Memorial
that's all
Hospital.
basically I can say.
Right.
The COVID census as of this morning, 32. We had 3 admissions yesterday. One went home, was discharged home. Of the 32, 13 of them are ICU level of care, and then of the 13, 7 of them are on ventilator support. And so that's where we stand right now with our COVID census.
Lillian, I wanted to share with you. I ran into one of the travel nurses yesterday. I believe from New West.
Oh,
Right.
okay.
Yeah. But I just wanted to share with you what she had told me was that I just asked her, hey, what do you think of Guam Memorial Hospital? Which kind of seems like it could be a loaded question, right? Especially for a nurse who's coming from the States or whatever. And what she had said was if her family was here on Guam and they got sick, that she would send them to the Guam Memorial
It's
Hospital.
breaking up.
She
Okay.
basically had high praise for the staff there at the hospital and said that she's not really concerned about the facilities, even though it is
You're
leaking.
breaking up.
But she said that the staff works hard and the level of care that they provide
Hello?
is really on
It's hard
another
to hear
level.
you. Breaking
Okay.
off.
Can, can you hear me now? Oh, yeah, basically,
I
Lillian,
think it's our internet connection.
how about now? Hi, Lillian.
I'm losing you. I'm
Okay.
losing you.
I'm here. I'm here. Okay, Lillian.
Hmm.
Can you hear me
I,
now?
I can hear you now.
It
Yes.
must be Monday. I think, is it Monday? Yeah,
It's
so
one day.
basically, this nurse had said that she was very impressed with the staff at GMH and that the level of care was outstanding, and that if her family was here and got sick, she wouldn't hesitate to send them to the hospital. And it's funny because she said, the facility, yeah, okay, I don't really care about the facility. It is leaking, but the bottom line is she had high praise for your staff. So I just wanted to share that with you.
Thank you. Thank you. That's great to hear. That's really encouraging, especially after last week's post article regarding the individual who the family came out and, you know, I just want to clarify that. The facts are the individual came in with symptoms of respiratory distress, cough, and fever. And yes, the initial test with the Abbott, came out negative. And it's possible that the virus load in her system was not sufficient when they did the swab. The Abbott machine did not pick up on the virus load, but in 12 hours, the another swab was taken and submitted to public health, and the PCR came back positive. And that happens with the Abbott testing device. Sometimes the analysis of it, depending on the technique and maybe the virus load that's in the system of the individual, then the analysis of the Abbott machine may not have picked it up, and so the result could come out to be negative. But because the individual was manifesting symptoms, the doctors were concerned, and so they wanted to validate and confirm it, and they did the PCR within 12 hours. And so, again, the facts are, and based on science, You don't convert. The individual did not catch the COVID in the hospital.
Mm.
She came with the virus already.
Lillian, can you give us a little more clarity? Are we talking about the uh, pregnant patient we asked you about last week, or?
Oh,
Yeah, Lillian, are you talking about the pregnant patient that Chris asked about last
that's
week?
right. That was put out in the post. The article was in the post publication.
Right.
Yes, that's the individual that I'm clarifying the facts.
So you're saying that was not a nosocomial infection, that
No, no,
she was
ma'am.
tested when she arrived, it was negative, and then tested 12 hours later, and then it was positive.
Correct.
So she
Because
was,
of the virus load in her system, perhaps was not large enough, or for the Cook Abbott machine to recognize that she does have the virus in her system.
and what is the status of this patient? She's still on
What's
a
that?
is she still on a ventilator?
You know what, I believe so, but let me confirm that. I haven't gotten today's census report. Um, she is still here in the hospital. Yes, that is true. That is correct.
Mm.
And as of Friday, she was on the vent. But today I haven't gotten the report, the updated report.
So what numbers did you give us from the census? Is that just from yesterday?
No, this morning.
Oh, okay.
This morning I get the numbers, but the actual detailed
I
report,
see.
I get it, 7:30, 8 o'clock.
Right.
So I haven't gotten it yet.
But there was an increase, Lillian, in the ICU level of care patients.
Yes, and like I said earlier, there were 3 admissions
Right.
during the yesterday. So yes, we increased our numbers.
Right.
Lillian, we haven't talked a lot about in a while actually, in the nosocomial infections over at GMH. Do you have any numbers regarding how many there have been?
There have been only 2 confirmed by the infection control practitioner. 2 cases that were confirmed to have tested positive during hospitalization for COVID.
Right.
There are different kinds of nosocomial infections.
Right,
So
Yeah,
right,
just regarding COVID.
right, we're just talking about COVID, correct?
And so the one of them was the ER nurse. Is that correct? The one that passed away.
Yes, ma'am.
And what was the second one, and when did this come about?
The second one is an individual, a male individual. This was already, gosh, probably 3, 4 weeks ago. The individual went home.
Can you tell us anything about their exposure at the hospital?
I don't have all the details. The individual was in the hospital for a different type of medical condition. And because the plan was to discharge the individual, I think the individual was going to be going off island for further treatment. And so the doctor just wanted to make sure. And so they did the test, and the test came back to be positive.
So I'm sorry. So the individual was hospitalized for before.
Hospitalized prior, was hospitalized for non-COVID medical condition. And because the doctor was going to discharge the individual, and the plan was for the individual, he wanted to go off island for further treatment. And so, the plan was to make sure that he's okay. And so they did the test. The result came back to be positive.
How did he get COVID? Was it through a visitor,
Again,
or
we
was it?
don't know. We don't know exactly how people get the COVID, because it's hard to pinpoint where the exposure is. He was in a non-COVID, in the non-COVID unit. I believe maybe there was family visiting at the time. I don't know. I have to get the details.
Right. But Lillian, if it was 3 to 4 weeks ago and we've been locked down for 8 weeks, that means that there probably
Sure.
weren't any visitors allowed at that time?
We have allowed on occasion, for depending on the condition of the individual, if they are high fall risk or if they are confused with dementia. And so we do allow a family member to come and be with the patient.
So was this patient in either one of those categories?
I don't have the details of that individual case.
Okay.
I do want to follow up, and I want to say Peter may have asked you about it regarding the GDOE nurses that were sent over to help out with the hospital, and I want to say it was 17, and now a majority of them are no longer there. Can you provide us what exactly happened?
Well, what happened was that, in the beginning, it was very fruitful discussion with Superintendent John Fernandez, Deputy Superintendent Erica Cruz, and the school health counselor administrator, Ms. Julieta Kineni. Very productive, very fruitful. We even had a Zoom meeting with many of the school nurses, and we discussed their anxiety, their concerns. And so we were willing to let them go through a very structured, however long it needs to take for them to have orientation and training, because many of them haven't worked in a hospital setting for many years. And so, of course, understandably, different skill sets that are needed in a hospital setting as compared to the school nurse practice. And so we started out with the list of 17 individuals. A couple of them dropped out before we even started the orientation. And then when we started the orientation, several more opted to not go through the process, anxiety, whatever concerns they have. And we understand that and we respect that. And so, as the orientation and training continued, many of them felt that bedside hospital nursing care was really not what they want to do in their nursing profession. And a couple of them in the MCH area, they were assigned, and they're still working there. And then we also recognized that we needed help in the contact tracing with infection control. And so I think about 4 of them are helping out there. And it's really been very helpful, what they're doing and how they're helping the contact tracing. So that's proven to be very fruitful. The rest, we decided that, we don't want to put the pressure on them. We don't want to force them to practice, in the hospital setting if they don't really, want to do that. And so, we recognize that, and we said public health needs help also. So that's where they are right now. Majority of them are over at public health helping out with community outreach activities because it falls within their practice as community health nursing. And so, that they're needed there at public health, and that's where they are, majority of them.
Okay, so out of the 17, how many are left standing at GMH?
I believe either 6 or 8. I can't remember the count, but 4 of them are in the contact tracing, and the others are in the maternal child health area. Nursery, OB ward, I forgot where else they are at, but maybe 6 or 8 of them are with us.
Okay. And also the EMAC deployed team, they're all gone now?
They're gone. Yesterday was their last day, yes.
Okay, Lillian, anything else happening at GMH? My goodness.
Plenty.
Just go.
Oh
Tell
my
us,
goodness.
Lillian.
Just again, take care, because look at that, this last positive results. What was that, 80 some?
82.
yeah.
82. And so, we're going to anticipate that, 10% to 20% of those individuals may start developing symptoms, and they may need to be hospitalized or be seen in the hospital.
Lillian, again, thank you for clarifying that the instance with the patient who had been pregnant, because I think a lot of people don't have that understanding of that, and we've covered it many times on the show, of the testing timeline and the window, when you can catch the virus too early and get a negative, and then, hours later get a positive.
Not hours. It's going to take, the incubation period takes, based on science, based on what's been experienced, it takes more than 1 day.
Well, thank you for that, Lillian.
Thanks, Lillian.
All right. Thank you too. You take care.
That's
Take extra
fair.
care.
Appreciate it.
Okay.
Okay.
All right. Bye-bye.
Bye-bye. Lillian Posadas, hospital administrator. Would give our sanitizing duendes a little bit of time to clean up the KUM News Zoom room before we bring in our next batch of guests. It's all part of the public health guidelines. We came out, we submitted our plan. We said, hey, we have